Thank you very much, Professor Su, for the kind invitation to this very important inaugural meeting of the Korean Society for the Dementia Care. My name is Ken Nagata. I came from Japan. I'm living in a very northern part of Japan. The temperature is almost same as Seoul, but we have lots of snow in the winter time, freezing. But this time, a little bit better than 2 years. But in Tokyo, they are attacked by the heavy snow today and maybe tomorrow as well. So Japan is a very aging society. As Dr. Fan experienced, Taiwan is facing the super aged society in the future. But we are already facing the super aged society. And Akita is my hometown. It's located, it's a very northern part of the main island on the side of Sea of Japan. We have highest rate of aging, more than 30% in our prefectures. For the men, and the aging rate is 25, but for the ladies, 33.6. Almost 1 out of 3 are more than 65 years old. So we are facing many problems with aging as well as dementias. So I would like to share with you our experience and the knowledge about the dementia and the stroke. So this one, start this one. So this is the DALI, daily rates from the Alzheimer's dementia in other dementias in the world. So red color means the highest rate of the daily. Daily means the disability adjusted life years. That means life years lost due to the dementia or other illness or early death. And this red color means more higher rate of daily. That's due to the dementia. It's located, Japan is red, and Australia, New Zealand, and most of the EC countries, and North America. So these are aging countries. Maybe Korea is still orange color, maybe, and Taiwan is still more yellow, but in the future will be much darker colors. So that means that dementia is one of the perils in our life. So this is Asia Pacific. If we're looking at the Asia Pacific regions, this is the prevalence of the dementia in Asia Pacific regions from 2005 to the 2050, 35 years from now. So red is China, and yellow is a curry color in India and other countries. Most of the dementia people in the prevalence in Asia Pacific region living in China, next in India, and that due to the massive population in China and India. This is a prevalence estimated according to the countries. The China. Now the number of the dementia people in China is not so high, but it will be exploring increase in the 2050s because of their huge national populations. India is here, and in Japan we have a high number of prevalence of the dementia right now, but Japan, its national population is not so high. And Indonesia, Pakistan, South Korea, and you will have some more. But as compared to the Japan or Indonesia, not so much. And in the future, in every country, we will be facing the increased number of the people with the dementias. And this is the incidence of the dementia. The meaning is different from the prevalence. How many people will develop in dementia in the future? And also, the figure is very similar to my previous slide. The China, they are facing a very high incidence of the people in the country. Japan, Indonesia, Pakistan, Korea, Thailand, and Taiwan is here. Taiwan not so much as compared to Japan. So this kind of the phenomenon in China, they are expected to have a huge number of the patients with the dementia in the future. This is one of the peril. WHO is very much concerned about China because they have one child policy and 20 years in their tradition. And then in the future, there is less caregivers in China as compared to the other countries. That is a big issue as the WHO is recently very much concerned. So I would like to talk about Japan, the advanced aging or super aged country in Japan. So this is a shift in the life table. Life table means how much people are dying at what aging. We have only the data from the 1950s to 80s and later. And this is from the Europe, Sweden and Switzerland. There, maybe more than 100 years ago, people are dying at the age of 70s and 80s. But now in Japan, people are dying between 80 or between 9 and 100. So living longer. This means the people living longer experience much more diseases, increasing dementia. If they survive a heart attack or cancer in their middle age, they may experience more with the stroke or dementia in the later life. This is a future population estimate in age category in Japan. This is 2005, and we are standing right here now, and in the future. The Japanese population is declining in the future. And you can see this is age of 0 to 14. This is a school age. It's also declining. And increasing population is in the top. That includes 60s and 60 to 65, 65 to 70, 70 to 75, or more than 75. And you can see this top red color means that more than 75 years old. This population is increasing like this. That's more than the children population in the future. And this means the increase of the population. We have been experienced and increase of the elderly population in these 50 years from just after the World War II. But you can see this increase was mostly yellow part. Yellow part means the age between 65 and 75. This is kind of the early elderly people. So, but now we are standing here. From now on, we will be experienced increase of the people, the age more than 75. So this is advanced aged elderly people. So the dementia care and care for the weakness or frailty is needed. That the situation has been changing. So prevalence of dementia in Japan. This is a very old epidemiological studies in Japan in the 90s. It said that age more than 65 years old, the prevalence was 44.1, 6.7, or 7.2, but more than 10%. So based on these epidemiological data, Japanese government estimated the prevalence of dementia in the elderly population in Japan is 7.5, less than 10%. That is very less. And then this is Japanese government estimate. Just 3-4 years ago, we used this data. It says 7.6. And 20-30 years later, the rate will be reached to the 10.7. So, but this was not true. So this is a newspaper from just 3 years ago. It said that the number of the elderly people with dementia doubled to 3 million. So this says that the number was much higher as the Japanese government estimated 3-4 years ago. And this said that 3 million people estimated have a dementia. The 99.9%, almost 10%. It says that the Japanese government estimate 20 years in the future. That's coming already. We are facing in this situation. But this is not true. Situation is much severe. This is a national survey by Dr. Asada's from Tsukuba University, Japan. They made a cohort investigation of dementia prevalence. This is a Joetsu city in Nagata. Their aging rate is 26.3. The prevalence of dementia is more than 16.2. Obu city is just vicinity of Nagoya. They are much younger. Aging rate is 17.2. That is much younger than the Japanese average. Even though the younger city, the prevalence of dementia was 12.4. And the average of these 6 cohort data said that 15.5. That is almost a double figures as the government gave us 3-4 years ago. So many people are concerned about the delay of the national treatment or national policy against the dementia or people with mild cognitive impairment. This is data from the same survey, says that this is the age category from the 65 to 69, 70 to 75, 75 to 80, 80 to 85, and 95. This dark red color is average in Japan. So the age category between 65 to 80, their prevalence rate is less than 10. But after 80, it's increased like this. The Japanese woman's life expectancy is now 87 right now. But in 10 years, that will reach to the almost 90 years. So if the Japanese ladies, they can live up to the average life expectancy, 90, 60% of them will be demented. No one can figure out these kind of numbers. So then the treatment and the prevalence of dementia is very important in Japan, as well as clinical care of the dementias. This is late onset dementia. Late onset dementia means the onset is later than 65 years old. Almost 2/3 of dementia due to Alzheimer's disease. And the 20% are due to the vascular lesion, vascular disorders, so vascular dementias. And DLB and Lewy body dementia and the Parkinson dementia, it's 6.2%. So most of them are due to the Alzheimer's disease. But the situation is a little bit different for the early onset dementia. Early onset dementia is onset is younger than 65 years old. Vascular dementia is 40%. Alzheimer's disease is 24%. And traumatic brain injury is 7.7. The figure is very quite different from the late onset dementias. So some of them are regarded as just a sequelae of stroke survivors. Sometimes they are not yet diagnosed as having a vascular dementia, and they're treated just as sequelae or stroke survivors. And also traumatic brain injury is sometimes they are regarded as dementia, but sometimes they are neuropsychological disorders following brain injuries. So the diagnosis is sometimes very much complicated. Incidence of dementia in Japan, and this is Dr. Yamada's study in Hiroshima. Hiroshima's atomic bomb survivors cohort. That says in more than age of the 60 years old in Hiroshima cohort. And the annual incidence per 1,000 people per year is 12% for the male, and the female is much higher. It's 16.6. because Japanese ladies live longer than the men. That is one reason. And another explanation is the Japanese ladies are smaller than the men. The small brain is one of the risk factors for the Alzheimer's disease, like one of the risk factors of the frailty. Frailty is one of the risk factors, so that may be two or more reasons the girls, ladies has a much higher incidence of the Alzheimer's disease as compared to the men. This is not Japanese study, East Boston study. They also show the after the age of 80s, incidence of dementia is higher for the ladies. But you can see the more than 90 years old, men's incidence is much lower. This is because very few people can survive at the age of 90s. But many of the ladies can live more than 90s, so the incidence is much higher for the ladies. Vascular dementias. This is a trend in the cause of death in Japan from the 1946 to 2011. The stroke is a bit dark red color. Stroke is a leading cause of death for 20, 30 years. When I graduated university like this, then we writing the paper about stroke. Stroke is a leading cause of death. It's almost in the introduction sections. But the stroke was the second following the cancer in the 1970s, and this is heart disease. So stroke has been number 3 in the cause of death in many years. But the year of 2011, stroke get down to the 4th position, and pneumonia was number 3. So this is many reasons, but main reason is about acute care, acute diagnosis, acute treatment of stroke is very advanced in Japan. We're using CT scan, MR scan, and thrombolysis in Japan. And also, many people can survive in acute stage. They have disability. One disability is dementia. The other disability is a motor disturbance. Third disability is their kind of the aspiration pneumonia. So maybe stroke survivors are dying in a chronic stage due to the aspiration pneumonia. So the stroke is get down to the 4th position in the cause of death, but the failure of stroke still exists to the effect in aspiration pneumonia in chronic stage. So the acute stage stroke death is declining in Japan. This is a risk of stroke by age. This is our epidemiological study in Akita prefectures. So this is overall risk in a stroke is purple color. Yellow color is a cerebral infarction. And the pink color is intracranial hemorrhage. And the dark red color is subarachnoid hemorrhage. When the age advances, risk of cerebral infarction goes up. As compared to the age less than 40 years, if you reach to the 80 years old, your risk for the cerebral infarction is 52-fold, very high. So if you live longer, you have a much risk of the cerebral infarction. And in addition to the explanation of my previous slide, if you have lived longer than 80 years, if you may have a stroke, but the risk of the stroke death during very acute stage is less. You can survive. You can survive on cerebral infarction, even your age is 80. That makes a disability in maybe that it's a very much effect on your cognitive functions. This is our epidemiological survey in post-stroke dementia. Those who experienced stroke, the rate of the incidence of dementia is 27%. But if you have no stroke history. Only 3% of them diagnosed as the dementia. These figures gives you an idea. The stroke is very strong influence on your cognitive function in the communities. And this is a result from the questionnaires we sent to the families of the stroke survivors. There are three categories. In your father or mother or in your relatives, not demented, or mildly demented, but they can doing very well with your family in your home, and they are severely demented. They are already institutionalized or hospitalized, or they need special care in daily life. So if you get a stroke in the age of 40, only 5% of them are demented, but none of them are very severe dementias. If you have a stroke at age of 70, 40% of them are demented, and out of them, 66.8% are very severe. If you have a stroke, get stroke in an age of more than 90 years old, majority of them are demented, and 1/3 of them are severely demented. So the post-stroke dementia, the severity of post-stroke dementia maybe depends on the age of onset. So the longevity and the age of society means people get stroke in the age of 80 or 90. That is a much more higher risk for the post-stroke dementias. So the post-stroke dementia due to the brain infarction, brain hemorrhage, and subarachnoid hemorrhage. So the brain infarction, 60-something are demented. And also brain hemorrhage, a little bit more, 40% of them are demented. But subarachnoid hemorrhage, only less than 30% of them are demented following subarachnoid hemorrhage. Maybe this is due to the age of onset. Subarachnoid hemorrhage, age of onset is much younger, 10 years younger than the brain hemorrhage or brain infarction. So the aging society affecting this kind of figures. So if you get older, maybe you have a more chance to have a cerebral infarction rather than subarachnoid hemorrhage. They may get demented much more than they have a subarachnoid hemorrhage. This is a Hisayama study in Japan. Hisayama is a vicinity of Fukuoka city. And Kyushu University have been doing the epidemiological study for 50 years. And this is a prevalence of dementia from the 1985, 92, 80, 98, and 2005. And yellow is a prevalence of the Alzheimer's disease. Red color is the vascular dementias. So the incidence of vascular dementia is almost the same as in these 30 years, but the incidence of Alzheimer's disease is threefold increasing. So the diagnosis of Alzheimer's disease is increasing as compared to the stable number of the vascular dementias. This is meta-analysis of the Japanese epidemiological study in prevalence of the dementias from 1970 to the 2005. So the trend in the prevalence of the Alzheimer's disease increasing from 97 to the 2000. So number of the people with Alzheimer's disease is increasing in Japan. By contrast, trends in the prevalence of the vascular dementia is mildly decreasing in these 30 years. So if we have a ratio against the vascular dementia and Alzheimer's disease, so the relative prevalence of the vascular dementia to the Alzheimer's disease, it's a decreasing in these 30 years. One is stroke care is a better in the getting better in the 20-30 years. Second one is diagnostic criteria has been changing in these years because Japan has a very high incidence of a high mortality of stroke 40 years. There are many of the doctors easily to make a diagnosis of vascular dementia if you find a small infarction on the CT scan or scar of the old hemorrhage on the MRI, easy to make the diagnosis of vascular dementia. Even though the most of the pathophysiology is due to the Alzheimer's disease. But nowadays, the clinical diagnostic criteria has been a little bit changing. We have more make the diagnosis of the Alzheimer's disease, even though they have a small hemorrhage or a small infarction on the CT scan or MRI. We have a new category of the AD with CVD, Alzheimer's disease with cerebrovascular lesions. In those categories, many of the elderly person with Alzheimer's disease belong to that AD with CVD categories. Then the incidence of the Alzheimer's disease is increasing as compared to the vascular dementia. That is another reason of this kind of the decline in the number of the vascular dementias in Japan. Changing in the environmental and this is the whereabout the patient with dementia. Dementia patient is living in what kind of the environment. Most of them are living in their own home. It's a home care. And small multifunctional home care service. This is a very complicated name, but the Japanese government likes this kind of things. This is part of the home care. And medical facilities, this is a hospital, more than almost 10%. This is a healthcare facilities and the care facilities with nursing home and the group home. They are more than 30% of them are living in kind of the institutionalized. And most important thing is half of them are living in their home and family members taking care of the demented people. This is a full giving a care on the demented people in Japan. Spouse, it's a 25. Children, almost 80%. Spouse of the children and other relatives. The mostly family members are giving a care in the patient with dementias in Japan. But the family structure is changing in these 40 years. This is a family structure in those who are more than 65 years old. In 1975, 40 years ago, most of them are living 3 generations like this, and the children, the parents, and the grandparents. And the grandparents are the patients. And now the living alone is only 8.6%. Now the very recent data shows the 25% of the elderly person, they're living alone. Wow. And 30% of them are only the old people, the couples. So this 54% are 3 generations in the 40 years ago. Now the 54% are living alone or together with the old generations. So this situation has been changing dramatically in 40 years. But Japanese government still insists the dementia care is basically on the home, because the institution and the hospital is very expensive, and try to keep them on the home. But it's very difficult because living alone, it's no family members. It's very hard to take care of in their home. So the age of caregivers said that the females, the more than 80 years, is usual. So the in my patients, some patients are more than 80 years. Both husband and wife, both are mildly demented. That is dementia care in Japan. That is not rare cases. In rural area, they are managing like such kind of situations. And I would like to a little bit talk about the long-term care insurance system in Japan. That started 2000. the insurance system has been established, supporting nursing care and institution cares. And half of the budget came from the tax, national budget, and half of the money came from the insurance itself. And persons from more than 65 years, and the person who are between 40 and 64, but they have like a dementia or stroke survivors, can join this long-term care insurance system. This is a 100% public system. And the nursing service maybe include the home helper service, basing service, and the nursing home visit rehabilitation, day service, short-term stay, and facility service consisting of the special nursing home or health care facility for the elderly, and the medical care facilities, and the neighborhood services, and the group home, and the small scale at home service. This is a very Japanese original complicated system. So this is a certification for the elderly, and someone has a stroke survivor or a dementia people for the long-term care insurance. We started year of 2000, not so much, but a number of the certification more than doubled in this 10 years. This is much more big number of the government expected or estimated initiation of this long-term insurance, long-term care insurance system in 2000. And this is a user of long-term care insurance system. User started, and this is a 1,000 unit, 1,049 people, but now its number is more than doubled in 10 years. And this is expenditures. Expenditures also doubled in these 10 years. This is Japanese this system that the budget is almost collapsing. So the government tried to squeeze to giving money for this system, but system itself doesn't work very well. This is causative disease for the long-term care insurance system in the data of the 2013. This is support system. It's a mild support. Care level 1 is very mild. 5 is very severe. Severe means the bedridden people or people with a very severe dementia who showing the psychological or behavioral disturbance. And stroke is this bottom, red ones. Stroke is in this care level 4 and 5, it's biggest causative disease. But it's care level 1, 2, 3, it's dementia. Pink color is a dementia. Dementia is most users of dementias. And number 3 is a frailty. Frailty is also another big issue for the elderly person. This is my last slide. Shows the Japanese government made this kind of survey from 2001 and every 3 years. When we started long-term care insurance system, stroke is a leading cause of this caregiving system. But percentage of stroke is declining, and the increasing number of the pink ones, this is dementia. So nowadays, dementia is a leading reason of the user of long-term care insurance system. This is also the big difference from the Japanese government, the insurance estimate when the beginning. They said the stroke will be the most leading reason for the long-term care insurance system. Nowadays, the number of the dementia people increased. So the dementia is the most important issue for the this long-term care insurance system in Japan. Thank you very much for your attention.
Thank you, Professor Nagata, for this wonderful lecture. 일본이 우리보다 먼저 장기요양보험을 시작해서 경험들을 쌓아왔던 것들이 있었습니다. 플로어에서 질문이 있으시면 질문을 좀 하시죠. 한국말로 하시면 제가 영어로 통역해서 나가타 교수한테 여쭤보겠습니다. 예. She asked you about the budget impact for long-term care insurance in Japan. How do you cope the sudden doubling of finance to support long-term care insurance?
Yeah, the half of the money came from government issue. Government means the national government and the local prefecture or city municipal government. They are increasing their budget to support this long-term insurance system, but we're nearly reaching the limit of the budget. Maybe in the future they need to increase the insurance subscription money instead of the increase of the government side expenditure.
예, 나가타 교수 말씀은 중앙정부나 지방정부가 우선은 이제 정부 재정으로 증가하는 비용을 부담을 하는데 이제 거의 할 수 있는 한계에 왔고 할 수 있는 건 개인들로부터 걷는 그런 그 아웃 오브 파켓 마니를 더 이제 늘리는 이제 결국은 이제 더 늘어나면 개인이 부담할 수밖에 없다. 제가 개인적으로 일본어에 대해서 굉장히 놀라워하는 건 일본이 갖고 있는 부의 양이 엄청나다는 겁니다. 우리가 생각하는 수준의 부자를 훨씬 넘어서는 부자라는 걸 일본을 가보면 느낄 수 있는데요. 그런 나라에서 장기요양 보험하면서 요 정도 수준에서 완전히 손들고 이제 더 못한다 이러거든요. 그래서 우리나라는 사실은 급속히 발전은 했지만 그 속에서 부를 충분히 쌓아서 성장한 사회가 아니어서 우리가 이런 어떤 급속한 그 재정적 수요를 감당하기에는 상당히 취약할 수밖에 없는 상태고 오늘 아침에 제가 조금 이 감정적으로 좀 심한 얘기들을 조금 하긴 했습니다만 실제로 보면 치매 노인이 길을 잃어버려서 배회를 해서 그러면 별로 찾으려는 노력들을 그렇게 열심히 안 하세요. 그래서 경찰이 다른 데서 찾아주면 바로 요양시설 행위입니다. 그게 사실 현실인 경우가 많고요. 심지어 지금은 테크놀로지가 발전해가지고 저기 집에서 키우는 반려동물이 누가 주인인지 알게 하려고 칩을 넣자고 하는 게 법안으로 뭐 해야 된다 그러지 않습니까? 테크놀로지가 없는 게 아닙니다. 의지가 없죠. 하다 못해서 자꾸 팔찌하고 목걸이 한번 잃어버리면 뭐 문신이라도 전화번호를 새기면 찾을 수 있잖아요. 근데 사실은 우리나라에서 KT나 이런 데서 미아 찾기 하면요. 서비스를 신청하면 등록한 30명한테 위치 추적한 정보가 전송이 됩니다. 그런데 치매 노인들한테는 그런 거 아니에요. 그러니까 사회가 별로 그렇게 효용이 있는 사람 아니라고 자꾸 느끼고 자꾸 내다 버리려고 하는 거예요. 그런 느낌들을 우리가 그렇게 하면 안 된다고 하는 얘기들을 하는데 지금처럼 하고 있는 사회는 별로 좋은 사회가 아니라고 저 생각합니다. 그래서 우리가 그런 입장에서 뭔가 조금씩 변할 수 있는 그런 계기가 됐으면 합니다. Thank you.
Thank you.